Thank you very much, Suranat, for that introduction. Can you hear me all right?
Yes.
Very good. Greetings from a sub-zero Sweden. It's still cold here up in the western hemisphere of the Earth. And I'm so grateful to be back at my favorite university of the world, Rangsit University. It's a very special place. I'm sorry I can't be with you in real life, but this is starting to be the new normal for all of us. So it's an honor and an experience. So think of all the things we can do with this cyberspace. We can reach out and communicate like this, and it's a space that really has a fantastic value to connect, and that is also what I'm going to present today in relation to my my topic and scope of today's presentation: the way that the internet transform our ways to speak and connect in relation to health concerns. So I'm going to share screen if that's okay. So we are moving from one area of research that was presented before to a whole different area. And we are also moving from a very quantitative to a very qualitative aspect of research. So my presentation today is about capturing the new digital normal, how to utilize ethnography in health-related research. And we know that social media over the past decades has dramatically changed our ways to communicate and human interaction in general. And we also know that the ongoing corona pandemic has further moved that way of communicating to social platforms. And one interesting question is how we as health researchers should capture this new phenomena of discussing health concerns that is not only taking place between the professionals in the healthcare sector, but more importantly, now is going to be a topic among the concerned themselves in social media platforms. So I'm going to present today ways of working with these new platforms and address them with research-wise using a method called nethnography. So as a generous presentation, I am a professor in nursing science. I'm also a registered nurse, and I've been working with trying to understand ethnography and how it could be utilized in health research for about 10 years. And the last publication is from 2021, and it's together with the editorial Robert Cousinets, who also invented the method nethnography, that he has published a book from all the different fields of research, from economics, engineering, health, marketing research. And we have written a chapter in that called Nethnography in the Healthcare and Nursing Sector. So I'm going to present some of the results from that publication. So what are the spaces for health concerns and discussion available today? You can use this cross of spaces to visualize the different possibilities that exist since internet arrived. Previously, we only had analog spaces shared between domestic and public spaces. And what has evolved during the last decades is the emerging of digital spaces. So going from analog public spaces, which exist, for example, in hospitals and clinical institutions. And that is where the most of the science in health are conducted today. We are reaching out to patients or former patients by doing surveys, or we are asking them questions in real-life interviewing. And that is capturing some pieces of this health concerns and how to work with it. But we can't capture the digital spaces in the domestic areas with that kind of research approaches. And what we also can see is a ongoing movement, as I told you before, from public analog spaces to digital domestic spaces. People are in their home, connecting and sharing with each other health concern, becoming their own health experts. And this is a trend we have to monitor as health researchers to capture what kind of new experts are arriving on the health market, and how are people addressing health concern in new ways, and how is the structure of power between patients and, for example, professionals reversed due to the digital era. So this is why we need to focus on this digital shift and pay attention to the changes in the health spaces and concerns that people have. So why is nethnography relevant to health researchers? The internet is an alien that just has landed, as David Bowie said in his interview with BBC in the 1990s. We even haven't grasped the curve of the changes that's going to be happening to all of us. So we are facing paradigmatic changes in how we live our lives. And as we can see now, as we're having this conference, cyberspace moves far beyond the traditional notion of space. This space has no physical distance. It is intangible, but still filled with content, as proven right now. It is boundless in its way of being, a word to integrate and meet in. So cyberspace creates that physical spaces for health-related concerns that we need to address. And also, we are just in the very beginning of the changes that's going to be happening. So what is nethnography, and how can you utilize it as a health researchers? Nethnography is a qualitative approach to the meaning people create to understand social interaction in contemporary digital communication contexts. It is a specific set of research practices related to data collection, analysis, ethics, rooted in participant observation as a researcher. In ethnography, the data originates through the digital traces that are occurring and gathered on the internet by public conversations and recorded by communication networks. You use this conversation and interpret them to understand the meaning and the experiences that are manifested through this digital communication. So it's as shown in the method title, Nethnography. It's an ethnographic and anthropologic approach to what is happening in cyberspace and on social media. And of course, there is a step-by-step description of how to conduct this method. And the first presentation that was published in an academic paper was by Rob Kosinets in his article, The Field Behind the Screen, Using Ethnography for Marketing Research in Online Communities. And of course, this is 20 years ago, so it has evolved since then, due to that social media has evolved, and also the ethics in relation to how to conduct ethnographic and ethnographic work, but also since the rules and regulations of both research and how you can use people's traces online has been regulated. But the steps in doing ethnography is very simple. You have to plan, you have to identify an online venue for data, location. You observe and collect data in that venue, for example, by downloading the different conversations, or downloading images, or downloading the data you need to have for starting, analyze it and report, interpret and then reporting. There's a lot of ethnographic studies being conducted, for example, by taking all the Twitter from a conference like this, sort them and present them. So that is not an unusual scientific publication for those who are interested in ethnographic work. So I encourage some of the participants to try to find the Twitter flow in this conference, download it, structure, put it in Teams, and then send it to a journal as an article. The most important trend of why we have to do this is that it is not only the patients or people with health concerns that are going digital. It is also the public institutions that are going to a digital platforms and try to control and give information and give health support through digital arenas. So as the Australian professor Deborah Lupton concludes, in an emerging surveillance society where the self-responsibility towards health is incorporated into the everyday domestic spaces via digital health technologies, a withdrawal from the welfare state from citizens' lives leave them to govern their own health through the existing digital resources. And this is also creating a situation where the clinic moves into the home but when doing so, also disperse into every possible spatial and temporal location. So this digital trend that we are seeing, where people will self-govern their own health through digital resources, is not only something that are happening by the citizens among themselves, it's also a drive from the institutions to be a part of this new digital steering and governmentality of health resources. I'm going to show you some examples of studies that has been conducted with Nethnography to try to grasp this new situation of the digital normal. In this study, for example, we approach and try to understand who the health experts was in the postmodern area, where you can do virtual performances. And we called this new interaction that are created through experts in forums as a conductment of cyber nursing, where people are interacting with others to create a situation to understand their own health and moves to a decision. So this is a study that can be conducted by going into health forums, observe the discussions, and trying to understand what kind of health support and resources are being experienced in this forum for the health experts, for the participants, and how do they trust the experts in the forum. You can also do ethnography studies in forums to try to understand what support means in this new digital normal. How are people sharing health concern, supporting each other in the new way that, for example, can't be related to the institutional supporting structures, and what kind of new support are existing in the digital space that are available that wasn't available previously, and how can we understand this new kind of digital movement. There is also a possibility to use social media to understand and predict the future of health institutions and nursing by, for example, analyze, like we did in this article, the various function and presentations of nursing robotics that exists in social media. And by understanding that, you also could grasp where we are going from here in the discussion and implementation of nursing robotics. So social media could be a way to really see things that will happen in the near future, because social media is not only connecting people, it is also connecting the institution with the companies, with the markets, with the people that's going to use the devices, for example, that are being introduced. So how this glue of interactions fit into ideas of changes in health are really interesting to both understand and also to present. And this is a platform for doing this kind of prospect into the future. For example, you can use Twitter discussions to predict and forecast nursing robotics in aged care, because you can analyze where the discussions are being held. You can analyze the attitudes, for example, to the introduction of the robotics, and you can predict the future for this by using nethnography. As I said earlier also, we really need to understand the interactions being done in cyberspace in relation to health support, health concern, and who the experts are emerging in this new kind of health interaction. And we have done research to try to grasp the different expert positions that exist in cyberspace. And we have called them as in this table. To give an example, the keyboard cowboy, who is solution driven, confident, an active writer, self-oriented, and worldly. Then we have the expert called the cyber aide, who are humble, confirming, acknowledging others' views, and soothe and relation driven. And then we have another expert called the health interest trader, that is objective, educational, provides a balanced position. And all these experts together creates the possibility to support and give guidance to people that are active in the forums that that create these kind of discussions. So we really need to understand the emerging of self-government of health. We need to understand how the virtual arenas are being used for different experts to create virtual self-care for patients, and how they torrent information to create real life decisions. And we are only on the cusp of trying to understand this new phenomena and try to use it in our research. This is the last slide that I'm going to present, and this is a way to give a structure of how exploring spaces for health in one area, the digital domestic space, could be used to understand the other spaces. Because by following a discussion in a forum or following social media, you can evaluate the institution's work, for example, by looking at the discussions and what kind of predicaments that you could change to give more accurate information or a better treatment and care. You can also understand how health are being utilized in the analog domestic area by following the discussions in the digital domestic space. And of course, you can evaluate the public digital space by following these discussions. So my presentation today has been about trying to motivate and present a few basic principles and approaches to how to use ethnographic studies in health. And I have also tried to provide some guidance on potential paths for the audience today towards a range of future nethnographic inquiries for you to discuss and elaborate upon. Thank you so much, Surat, for giving this possibility for presentation.
Okay, so right now it is the time for question and answer. If anybody have a question, please ask Professor Henrik Eriksson.
Yes. I have a question, yes.
Yes.
Can you hear me?
Very good.
Yes, nethnography, I think it's very, very new to me, and I really don't understand it. I cannot differentiate it between the discussion in the Facebook or even in the line. Yeah, this is a kind of nethnography. I mean, if we discuss in terms of health, health problem or health issue, yeah, is a kind of nethnography. And another thing is, how can we prevent or avoid the misleading information or the fake information that can lead to the more troubles? Thank you very much.
Thank you. Thank you so much for the question, and it's really accurate and very important. We can't prevent fake information. We can't prevent fake experts, and we can't really do anything but try to understand how, for example, people in forums are discussing questions, for example, like vaccination, anti-vaccination movement. And we could understand the arguments and the different experts that are giving those platforms to address the concerns from another angle, but we can't really do anything more than just observe and try to find a meaning. So I'm not encouraging to use nethnography as supporting trends into a digital platforms, but we need to understand how the digital platform are used by the new experts that arose in the platforms.
Okay. Thank you very much.
Thank you.
More question, please. Yeah. Do anybody have more questions? Encouraging. Okay. Right now, I would like to have your cooperation a little bit about opening the camera,